Assalamu alaikum, welcome everyone. We will take a time just to start عشان for the time, short, to not take any taken from us. I would like, this is one of the interest grand round table. It is regarding the volunteer. We would like to discuss on this table the challenge, the future, the past, and the mission vision. And from our audience, the experts who face this, and we share the experience with them. Today, I'm glad to have Mr. Talal Al-Anizi, who have the experience to cover more than 70 charity in his field. And Ms. Huda Arishi, he's one of the head of department in Cath lab, her expert to share with us the knowledge in the Cath lab and her experience with the charities attendance. Ms. Azuf, Cath lab senior nurse, and she's going to present with us also his experience with the charity volunteering. Mr. Faisal, he's going to cover with us the covering the locum and the volunteering, the story in Al-Hajj. I would like all of you to enjoy with us today. And after that, we're going to have the open discussion for you regarding this topic. Mr. Talal, from your experience, and you are today with us covering more than 70 charity. We would like to see these things from your eyes and from your experience to share this with the audience, covering all the points that you, from your side, feel we need to know about it. Thank you.
Thank you, Ms. Denise. First of all, I want to thank you for inviting me to be a part of this event. I might be the only respiratory therapist among the whole group here. I started charity mission in around 2010. Before that, it was just, let's say, personal and a person-by-person effort. There was no organizations, there was no funding, there was nothing. But people still are doing it as volunteering by person. Then later on, around 2010, the societies in Saudi Arabia and outside Saudi Arabia started to join in and organize these charity missions and missions of volunteering. I think I remember the first organization I joined. It was the Islamic Muntada. It's a charity society that was established in the UK by, I think it was Saudi students in the UK at that time. We started working in Africa, we started working in Eastern Europe and some poor countries, until the time King Salman Humanitarian and Aid Center was opened in 2015. That's the time we brought volunteering and charity to the second level or an extra level. And it's more organized now. It's under the umbrella of King Salman. And since then, I've done a lot of missions outside Saudi Arabia. I wouldn't say all are charity, but it was volunteering job. All of these missions were volunteering job. Volunteering for me, I know we don't have a certain topic in this interview, but it's mainly for you guys to ask and see whatever point you want to discuss. For the meantime, I'm talking about what I did before and what's the missions I've been through. Volunteering for me is not only an act of service. It's a message that we deliver as volunteers to the other nations. It's not only work. It's how we present ourselves, how we present our country, and how we present our professions as medical practitioners. There are a lot of things that happen during these missions, but in general, alhamdulillah, we managed to accomplish, and we managed to treat people, and we managed to show a bright view of what we do outside our country. Thank you very much.
Thank you. I appreciate this, Mr. Talal. Going to Ms. Huda, as I know, you have recently one of the charity that you joined. From female side, okay, from the, we need to share this experience. We need to know about it more.
Assalamu alaikum. Thank you, Mr. Nis. It's my pleasure to be with you here. The firing is starting with somebody calling me to share the volunteering and to be the member of the Cath lab nurse. So when I said yes, I accept. That's the time I a little bit scared because I don't know what is the details. After 1 week, the leader met in group and he gave us all the safety instruction about the place where we go and what our role there. Actually, it was very, very good to help the people and to just to see the satisfaction of them when you are giving some help. Actually, the health volunteering, it's a wonderful and great job. It will make a difference to the people's lives. So I was very happy. And there is also a benefit, sure. I built some, what is that, communication with the people, and I gained some skills. There is also some exchange skills between us and them to make also relationship with the patients, with the family, and they are very, very happy. And also, I mean, not forget, represent my country if I am controlling myself or I give something good to that people.
Thank you. So really appreciated. Going to you, Yusuf. I know you since starting the journey, but now I'm really proud and surprised. I need to know the challenge that during this experience. Today, when I see you join the volunteering, what is the challenge? What's from your side the requirement today to be there? Okay. So what we're gonna face? What the team who gonna join recently? Who joined so I need to know about it, and they need to.
Thank you, Louis. First of all, I would like to say it's such an honor to be here to operation by the experience of the hospitals and missionaries. Another piece of my very center and volunteering countries with limited resources. It's life changing experience actually, not only for the patient and our served, also for us as healthcare provider. So before the mission, the preparation, organizing for a successful mission, and
I take it that.
So preparing and organizing for a successful Cath lab mission, this need to be ensured the supply lists completed and ready for sharing. Also, coordinating with a local hospital and assess the number of cases that we will do and time procedure. It's also very important to ensure the significant impact on patient outcomes. Actually, I have example here. Many centers that we went to in missions, the primary access for them, even for diagnostic cath, it was femoral only. So we bring with us radial sheath of course, and we trained them how to do it and how to deal with it. Also for me, the important part of being a volunteer during the mission, the training that we will give for the local staff and sharing the knowledge. So I believe in the local staff, they have the skill, but there is lack to access the advanced training and development. Also the updated technology as well. So I believe if we can treat patients only, we can save 100 lives. But if we can training the local staff and develop the skills, we can save 1,000 lives.
Sure. Yeah, sure. This is the purpose actually from any the charities and to go there to cover a lot of cases. It's saving life, and as much we saw the numbers, how we cover in King Salman Center, how many cases they publish it. This is really impressive and made us all proud in this. This is one of the things moving to the big things we are all of us waiting for yearly al-Hajj. Okay, so all of us, we work hard and run to participate. Today, Faisal with us to share the process, how they prepare before the supply, and so we need to point these things, the staff arrangement and the scheduling. So welcome, Mr. Faisal. Please take.
Thank you so much. Assalamu alaikum. Actually, when we are talking about the Hajj, all of you knows that it's the largest mass gathering in the world, around the world. So when you are working in the Hajj for continuously 15 days, 12 hours, continuously, sorry for that, you are facing a lot of patients. They are difficult came to Saudi Arabia to perform al-Hajj. So the most difficult thing when you are seeing someone, he is before end of the Hajj or only 1 day or 2 days before the Hajj, he just collapsed and came to the hospital. Alhamdulillah, we are here in Saudi Arabia. We are providing a high quality service for the Hajj to make them complete their Hajj, even by ambulance or sometime if they are walking, they can use buses and under health provider vision. Sorry. So Hajj, we are facing difficulties in the age group of the people. Most of them they are elder people. Most of them above 60, and they came in bad condition because of the dehydration and the hot weather. So we are using a lot of things or a lot of methods for transforming the Hujjaj from the Mashaa'ir or from Al-Haram to our centers, just to help them and to provide STEMI or non-STEMI procedures. The things we are seeing it, that we are seeking help from the other people from other centers just to join us and do this honorable mission, which is difficult and harm for some of them because you will be far away and you are working for 12 hours for 15 days continuously without any rest. Only you have to sleep and come back to work every day. And this is for mentally, I think it's difficult.
Yes, this is one of the challenge actually.
Yes, for sure.
We all of us, I think, and who attend with us, who passed through this experience, I think passed through. This is one of the great experience, and I had in 2013 to go in Hajj volunteering. I remember I lost around 10 kilo. Whosoever he planned to have a diet, so welcome to Hajj, so have it. You're gonna have only maybe one meal. Hajj is really one of the nice experience. So I think we need to go today from a message. So if we're gonna go today from this session, a message to be taken. So what do you think, Mr. Talal, the message you will give it as advice from the charity you are looking for from our colleague to give it to them, to be ready?
Thank you, Mr. Faisal. I joined Hajj missions also myself several times before, and it was a great challenge. The beauty about it is all of the treatments and everything is free. Mashallah, this is something very nice that we should be proud of in our country. Alhamdulillah for them. For my take-home message for the volunteering work is I always appreciate what we have here in Saudi Arabia and in the GCC countries. I've been to countries, they don't have the minimum. and we have, alhamdulillah, a lot. There are things that you pass by every morning and you do not feel: electricity, water, clean environments, beds and bed sheets. Simple thing in a hospital we do not even appreciate. Simple things in our life that we do not even sense. But when you go outside Saudi Arabia and the GCC countries to, let's say, some poor countries in Africa, you will really appreciate what you have here. Working in poor countries in the medical field will show you how miserable some situations are. But when you come back to your country, you will be very thankful for what you have. Thank you very much.
Appreciate it. Ms. Huda?
Yes. Even also, you just remember, you are representing your country. You have to control your behavior. Don't choose where I will go. So if you ask you to come to change to be a river, okay, be ready. Wherever you will go, you are ready. Don't say it, because some they are telling you, I don't like to go there. They don't like to go there. You are coming here to help. That's it. Thank you.
Ms. Azuf?
Like this.
If they can be ready for the challenges that may happen, like language barrier. We know all the communication, it's an important part to provide the best care. Also, limited resource, how we have the problem solving skills. Last thing, maybe the volume of a patient plus working for long hours. This is, we have to consider it. And last thing, maybe every volunteer, he will not represent himself only, but also his country, hospital, and the Gulf society. So from here, I would like to say I'm very proud to be one of them, and hope everyone can participate in some missions. Thank you.
Mr. Faisal?
Actually, you will feel depressed, exhausted, but in the end, you will feel satisfied. And believe me, in the whole year, you will think, I will not join Hajj mission anymore. But once you get the phone, you will accept immediately. Thank you.
Thank you. This is nice. I appreciate, and we appreciate your attendance. And now it is open for any question you need. Please, welcome. محمد عنده experience فهي كان share it هذا الصراحة يعني.
Sorry, not self kind of simplified. Okay, background and medical. Started with coding. Okay, so let's talk about again the charity. So Azufa and I we did the last time. My last charity was with Azufa. We went to Nairobi, and then she ditched me in the one after it.
So one of the beautiful things about these experiences, you get to experience you would actually end up learning and seeing stuff really interesting. Like one memorable one, during COVID, no planes. I'm used to working in my previous job. Every week I was on a plane, so I kind of missed it. So the only choice I had is to go on a C-130 military plane to Mkella. And that was in Yemen, to be exact. So it was COVID time, it was interesting. What was interesting to learn, and actually what happened out of that, the learning thing that I had, is the way they did the procedure. A single lab doing 20 cases to 30 cases per day. However, how many beds did they have? 4 beds. I haven't seen a radial, and they were working radial, by the way. What's interesting thing that I took from that, and if I actually give it a more modern look and more interesting look, I discovered that actually the way they were working like an angio suite, like a transradial angio suite, which is what's been used in the UK, Europe, majority of Europe. A fast turnover, and subhanAllah, it's so efficient, it scared me. And I sat with the physician, one of the physician passed who did that procedures, and we talked about it, and actually they presented the way they turn over the patient there. So that's a very, very interesting experience. Other than that, I think you have to learn something when you're going to these places. You would actually need to behave, the behavior is important, but subhanAllah, the energy that you get out of it, it's amazing. You don't, I remember one time in Mauritania, for example, wake up 7 in the morning, Allah يطلع فيها, if you know Dr. Rada Bolata and Dr. Ali Masoud, I felt like an old man with these guys. 7 in the morning in the lab, when are we back? 1:30 in the morning, actually. It's heartwarming, touching, it has an additional flavor to your work, so I really recommend everyone to do it. Thank you.
Thank you, Muhammad. Thank you very much, everyone. I think I shall to move to other session. I would like to thank our audience and to close this session. As summary, this volunteering, it is not easy. It is a lot of challenging, but it is full of love. Just to create the way to get it success for all and work for your patient. At the end, we are not to present ourselves. We are present a big community behind us. So we need all to present it well. Thank you very much.